Hi, this is Dr. Grace Chen. I'm a licensed marriage and family therapist and MGR-approved EMDR consultant. In the past 2 years, I have facilitated 85 EMDR basic training consultation groups and over 50 EMDR certification groups. So I conducted a qualitative research using my basic training consultation group notes and identified the 10 most frequently asked questions from my consultees. This series of short videos are designed for the beginning EMDR learners who start out incorporating EMDR into their daily practice. The second frequently asked question in the basic training consultation group is, how do you know the client is ready for EMDR? The answer to these questions are two parts. First, the client may not be ready to proceed with phase 4 reprocessing, but it is always ready for EMDR therapy. I often remind my client that EMDR is an 8-phase, 3-prong protocol. The moment we enter the therapeutic relationship, I'm already operating based on the AIP model and the phase 1 history-taking protocol. So EMDR basic training teaches that assessing the readiness is an ongoing process in the phase 1 and 2. And as a clinician, we have to continuously evaluate where the client is and preparing them before entering the phase 4 reprocessing. Resourcing is part of the phase 2 to prepare for reprocessing if we sense the client is not ready. However, phase 2 is not just about reprocessing. It is essential to manage your personal and the client's expectation to avoid rushing into phase 4 reprocessing. These are the readiness criteria. First, tolerate distressing affect associated with unprocessed memory. Remember, the memories that we ask the client to bring up are the memories that they don't want to think about and they try to push away in the past. So therefore, they have to be able to tolerate some distressing affect in order for us to ask them to remember activating so that we can desensitize. And then at the end of the session, reprocessing will continue and the client's ability to shift back to the relative calm place become an important criteria so they can continue to function outside the therapy room. Client also need to be able to maintain dual attention. That is, they have to be 1 foot in the present and 1 foot in the past. Dual awareness is what allows the client to engage the target memory and associate distressing experiences without becoming fully flooded or dissociated, which will keep processing within the window of the tolerance. Therefore, does the client have internal or external skills or resources to self-regulate, such as do they have hobbies, grounding strategies, friends, etc., etc. Last but not the least, the client needs to be in some stability in their lives while going through reprocessing, as we are bringing up buried traumatic experiences and the reprocessing continues outside the therapy room. So sufficient stability allows the client to work through trauma.